Thank you all. So as we proceed, we shall now introduce the next speaker. So now it is my pleasure to introduce our next speaker, Professor of Environmental Health at the Yale University School, Michelle Bell. Michelle's research investigates how human health is affected by environmental conditions, including air pollution and weather. Her other research interests include the health impacts of climate change and environmental justice based in epidemiology, biostatistics, and environmental engineering. In addition to these, she currently serves as a director of the EPA-funded Solutions to Energy, Air, Climate, and Health Search Center. Thank you for being here, Michelle.
Thank you so much for this invitation. I'm so excited to be a part of this exciting event. I'm going to try to share my screen. I can't see what you see. Can you please let me know if you see my full screen slides?
Yes, we
We
can.
see you.
Wonderful. Okay, then I'll get started. So I want to talk about environmental health disparities. And by this, I mean, of course, the fact that some individuals and communities have a disproportionate health burden from environmental conditions than others, and talk about how data science can help elucidate some of these environmental health disparities. And I thought I would begin by sharing a slide of what I consider one of the earliest data science investigations of environmental health disparities, which was about a cholera outbreak in London in 1854. I'm sure many of you have seen this map, but this was an event where there was a massive cholera outbreak in London, and John Snow, who was a physician pictured there, did an on-the-ground analysis where he mapped where the people lived that were dying. So each little black horizontal line represents a death, and where you see those bars, that means that's a residence where a lot of people died. And what he saw was a spatial cluster around one particular water pump, the Broad Street water pump. He actually did a lot more data analytics than just the map. But he was able to show through this early analysis that there's something happening with this water pump, and that's what's associated with this disease by looking at these spatial patterns. So why am I talking about this in terms of environmental inequity? Well, not only was waterborne disease not understood or accepted at that time, but the prevailing theory of why there was a cholera outbreak in this low-income community was that it related to the morality of those individuals. So the idea was that these people, they have bad behavior, they have low morals, and therefore that's somehow impacting their health. And Dr. Snow felt that this was not the case, that there was something else happening that was causing these people to die. So this is an early example of how these intersecting systems of science, environment, and health intersect with culture, socioeconomic systems, prejudice and discrimination, and so on, to create a system of environmental health inequity. And of course, we have many more forms of environmental justice. And here I just want to go through a few examples. So the most commonly discussed is that some people have higher levels of exposure. So imagine you have different communities. Some people live in areas of high air pollution. Some people live in areas of low air pollution. Another commonly researched example is higher health response to a given level of exposure. So even if we could press a button today that made all environmental exposures equal across everyone in the world, we would still have enormous environmental justice problems. So an example of this could be a heat wave. So imagine everyone's exposed to the same heat wave, but who has central air conditioning and who doesn't, right? Who can afford to turn it on and who can't? So we all can have different responses. And then there are many other forms of environmental justice, including more beyond what I have listed here, but just to give a few more examples, we should also think about different access to environmental benefits. An example here could be urban green space. So what communities have green parks in their neighborhoods and what don't? Another issue that I'm very interested in is lower access to information. And I'll talk a little bit more about this later, but we actually have more data and better ability to estimate environmental health conditions for some people than others. And I view this as another area of inequity. And then we could think of many others. One is high impact from environmental disasters. Which communities have the capacity to respond to an environmental disaster or climate change and which don't, and more. So what I'd like to do with you today is go through a few examples from my research team of some of these different types of environmental justice issues and show some examples where data analysis is able to highlight that there are these environmental justice problems happening. And I want to mention that while I'm using examples from my own work, this is of course a very active, vibrant area of research, and there are many, many other research teams and scientific studies as well looking at similar issues. This is a slide that I took from, or a figure I took modified from an article in Science. It's not my article, that is trying to make the point how everything is connected. And I think this is really important when we think about environmental equities, because this interconnected systems, like what we had with John Snow, will come up in every single example that I'm going to share with you today. So here we have the physical chemical systems that could be like atmospheric sciences affecting air pollution and so on. But we also have enormous differences in socioeconomic inequalities. We have different occupations. We have different access to healthcare. We may have different diet and nutrition. We have discrimination and structural racism. And all these things are happening together to create these systems of environmental inequity. And another point I want to make is that all of this is happening under a backdrop of a changing climate. So most of the examples I'll talk about today are about environmental injustice happening today in the present day, but all of this can be affected by climate change. And most of the time, or much of the time when we talk about environmental health and climate change, we're talking about what's happening in the lower right-hand corner of this slide, where you're thinking of heat waves, weather-related illness, expansion of habitats related to vector-borne disease, and so on. But really, almost maybe every aspect of how climate is impacting the world can have an impact on human health, and will likely do so in an inequitable way. So just a few examples. If we think about agriculture, there could be different access to food and nutrition and food quality due to changes in crops. Just taking one more example, looking at water resources, is we have lower access to clean water and sanitation. We could have situations of environmental refugees and so on. So really, climate change is very tied to environmental inequity as well, both in terms of the impacts and the ability to respond. So next, I want to go through several different examples from our work looking at environmental inequity. And the first project I want to share with you is looking at how air pollution from wildfires impacts people, and different types of how different populations will be affected differently. And this work was led by my former master's student, Lucia Wu, and also we collaborated with Dr. Loretta Mickley at Harvard. And this map is showing you for Alaska, what are the spatial patterns of increases in smoke from wildfires under climate change. It's kind of a mid-level climate change scenario in the 2050s to the present day. So you see that much of Alaska is anticipated to have an increase in wildfire smoke, but it's not the same everywhere. So some areas will have a much larger, like up to 3% increase in air pollution from wildfires compared to other areas. And we can overlay these spatial patterns with spatial patterns of where people live to think about how different populations will be affected. So this map shows the population distribution of the Alaskan Athabascan tribe. And this figure shows month-to-month estimates of wildfire smoke, this is present day, for different indigenous populations. And you'll see that everyone's affected, but based on these different spatial patterns of where the smoke is happening and where people live, some people are much more affected than others. And the Alaskan Athabascan tribe has the highest exposure from wildfire smoke of the communities we looked at. So the point here is that we see large areas of Alaska anticipated to experience extreme increases in smoke from wildfires, but this will not be distributed evenly, and some communities will be much more affected than others. Let me move on to a different type of environmental justice. I mentioned access to environmental goods, and so here I'm talking about green infrastructure. So you could think of green roofs like you have in the upper left-hand photo here, or different green stormwater control measures, which you see on the right-hand side, and so on. And so where are these infrastructures being installed? And so here I want to highlight work by my doctoral student, Alicia Chan, who looked at where these types of structures were installed in Washington, D.C. And what she found is that green infrastructure for stormwater control management was more likely to be installed in communities of color and low-income communities. So if you just stop looking at the data there, it looks like it would look like, falsely, look like there's not an environmental justice issue. In fact, it would look like the historically and currently disadvantaged communities may be benefiting more from green infrastructure. But that's not actually what's happening, because what Alicia did is look at this data over time. And so what you see here is an example of green gentrification, where what you have are changing population demographics after green infrastructure for stormwater control management is installed. And so, and she's accounting for like the temporal trends of demographics before the installation and other factors. So here she's divided the communities into 4 types of communities. In white are communities that did not have any of the green infrastructure installed. And then the pinkish reds are communities that did have it installed, and the darker reddish color are places that had more and more green infrastructure installed. So what you see here, looking at the left for the communities, looking at the percent white, is that communities that had no green infrastructure installed, the percent white went down. Everywhere else, the communities where the green infrastructure was installed, those communities became whiter and whiter. And the more green infrastructure they had, in general, the whiter they became. And if you look at the Black population, it is the opposite effect. So the percent Black was going down everywhere, but much more so for communities that had green infrastructure. Then if we look at the Hispanic Latino population, we see increases across all 4 types of communities, but less so when you have more and more green infrastructure. So this is a really good example of how, when we think about our data analytics, it's really important not to just look at a snapshot in time, but to consider temporal trends and think about the impacts and how it affects inequality over time. Because if Alicia had not looked over time, we would have missed kind of the big picture of what's happening here. Now, sometimes we look at snapshots in time because that's important for our research question, or that's all the data we have available. But this, I think, really emphasized how it's really important to try to dig deeper when we can. And since we're talking about data today, I want to talk about big data. And we need big data. I use it. I'm sure many of you use it. We all use it. We all need to, for all the reasons that we know. But what I'm trying to say here is that I'm arguing that we should not miss what I call small data. And so this is just a table and figure from a paper with my former PhD students, Dr. Amruta Nori Sarma and Dr. Anova Gurung, looking at data collected in Nepal and India for health, and talking about the challenges and advantages of what I call small data, right? So the challenges are large. The data quality is lower than what we would see in like the US or Europe, for example. Some variables are missing entirely. So as an example, in some cases, we don't have, for those of you who work with health data, we don't have ICD codes. So I may know that there was a death, but I don't know the cause of death. In some cases, in many cases, the data was on paper. So they had to be transferred to another system to be analyzed. Just as one more example, some of the hospitals we worked with in Nepal, they, at that time, deleted records after 5 years. So if researchers or some other organization are not collecting data, the data set never goes beyond 5 years. That was their capacity at the time. So there are a lot of problems and challenges with this work. And for those of you who work with this type of data, you know, there's challenges in sometimes getting the work published, because reviewers will talk about data quality and so on. But my argument here for small data and why it's critically important is that many of the places in the world that have the most vulnerable populations, the biggest health problems from environmental conditions, and some of the biggest inequity issues are not places that have big data compared to what we see elsewhere. So if we focus exclusively on big data and don't welcome small data as well, we are missing critical environmental health areas and populations that are particularly vulnerable. Keeping with the theme of thinking about vulnerable populations and places that don't have as much data, I want to move to an example of environmental health disasters. And these are photographs from landslides in Indonesia, and you can see the phenomenal devastation that these landslides produce. Of course, these are increasing due to climate change. And so you can see enormous devastation to homes and to agriculture and occupations and businesses and so on. So what happens to these communities? And this figure is from work from my former PhD student, Kate Burrows, who has done some analytics and conceptual framing around environmental refugees and environmental migration. And here she's thinking about, we could think about these moves being voluntary or involuntary, although we need to think carefully about what's a voluntary move. And it's really a spectrum, of course, and how much do people really have the agency to make the decision to really volunteer to decide that to move versus really not having as much choice. And then we also could think of moves as permanent or temporary, where people move due to an environmental disaster, environmental condition, and then move back. This is critically important for us to understand, is this will only be increasing under a changing climate. And here Kate's given you some examples of some different types of environmental moves. So you could think of an involuntary permanent move is someone who moved due to a wildfire, moved permanently. And then you could think of a temporary voluntary move is seasonal migration for occupation. And so this is I would argue, a growing area of research where there is some data, but I would argue that there's not as much data as we need. And we need to think about the data in multiple ways. One is, of course, what happens to the people that move in terms of their economic conditions, their health, their mental health and well-being, their social cohesion, and so on. We also need to think about the communities that are left behind. And often this comes into two distinctly different sets of communities: people who were rich enough to not have to move, and people who were too poor to be able to move. So we need to think about community left behind and recognize that there could be some big differences in those populations. And we also need to think about what data do we need from the receiving community, communities that are taking in environmental refugees, and how are they impacted. And so a lot of the examples I've been sharing with you about environmental justice, and a lot of the examples that are most commonly discussed, deal with, of course, race, ethnicity, and socioeconomic status. But unfortunately, issues of environmental justice affect many other different types of vulnerabilities and populations as well. As an example, rural populations in the US have a lifespan several years lower than their urban counterparts. And that's after you adjust for things like race, ethnicity, and socioeconomic status. And this is really important because intersectionality comes to play a role. So if a person is, let's say, African-American and living in a rural area, then they are doubly hit compared to a person in an urban area and so on. So, we need to expand our analysis to multiple different types of vulnerable communities, especially considering the intersectionality, especially the intersectionality with race, ethnicity, and socioeconomic status. I want to give you a couple of examples. So this is work led by my former postdoc, Kelvin Fong, who did several landmark papers looking at environmental health disparities for immigrant populations. And the paper I'm showing you here is looking at whether or not immigrants to the US have higher exposure to PM2.5, so small airborne particles, compared to people born in the US. And the answer is yes, they do. And here what he's showing you is a map of immigrants from Africa. So if you look at the 2x2 color legend there, counties that are in yellow or red have a high percentage of immigrants, in this case from Africa. Counties in green and blue have a low percentage of immigrants, in this case from Africa. Counties in blue and red have a higher air pollution exposure, and counties in yellow and green have a lower air pollution exposure. So of course, in his analysis, he did much more sophisticated things than dividing into 4 counties. But I think this map is actually very useful because we can see visually a lot of the US is red, right? So immigrants to the US have a higher air pollution burden than native-born US populations, and particularly for immigrants from Africa. And this, of course, will have intersectionality with other issues of discrimination, with socioeconomics, access to healthcare, language barriers, and so on. And another environmental justice population that I argue is incredibly understudied is the LGBTQ+ population. So this figure is from a paper with my former master's student, Leo Goldsmith, outlining a conceptual framework of different ways in which the LGBTQ+ population can face disproportionate environmental health burdens. I would argue, so there's some work has been done on this. I would argue that it's not very much and definitely not enough. But let me just give you a few examples of how this is happening. So there have been documented cases of transgender persons being turned away at shelters or for resources after hurricanes. Think about if there's an environmental health disaster and people need access to their medication. Think about if there is some type of health problem, some populations may be less, feel less safe going to access healthcare and may not get as good healthcare. And then there's other issues too related to housing discrimination and so on. And this also is really important for the issue of intersectionality. For example, a transgender person of color is facing the discrimination on multiple fronts. And this does impact their health in terms of how the environment impacts their health conditions. And so I've given you a lot of examples of science looking at environmental health disparities. But I also want to take a step back and think about who's conducting that science. And we have enormous disparities in who is conducting science when we think about multiple different frameworks. One could be socioeconomic distribution. Another is racial ethnic distribution of scientists compared to the general population. And another example is based on gender. So this is some preliminary work with Jiyoung Sun, looking at corresponding authors we could think of for senior author for analysis of almost 120,000 journal article submissions. And for these fields, we see that the senior authors are overwhelmingly men. For astronomy and astrophysics, it was roughly 90%. But even for areas like environmental science or interdisciplinary research, it's like roughly 80 and 85% men. And we would see similar disproportionate distributions if we look at race, ethnicity, and other factors as well. So when we think about data science for environmental justice, I encourage us not only to think about the science itself, but to think about who's conducting that science and what voices are we missing in the scientific conversation. So now I want to bring us back to that figure from the article I referenced at the beginning of my slides, of the interconnected systems of ecosystems, social systems, physical, chemical systems, and lifestyle. And I suggest that we need to add to this because there are many other things happening as well. One is we have an increasingly aging population. People, in the US, it's becoming an increasingly aging population. We have an increasingly diverse population. We have economic inequality and growing economic inequality. We have unprecedented urbanization everywhere in the US and in other parts of the world as well. And in many parts of the world, you have unplanned, in some cases unregulated urbanization in housing structures, transportation systems, and so on in ways that have enormous environmental health impacts. And these decisions are being made now and will impact human health and environmental health inequities for decades to come, if not longer. This was brought up by Jude in one of the questions, the issue of scientific denialism. So here I'm just distinguishing between scientific literacy and scientific denialism. So just very simply, scientific literacy, I'm thinking of in terms of, do people understand the science? Are they aware of the science? Scientific denialism is something completely different, which is rejection of the science. And we see this with climate change. We see this for the pandemic and vaccines. And we also see it for, I deal with this a lot, we see this for in other forms of environmental health conditions other than climate change as well. So producing the best scientists at best, science is not enough. We can't just produce it and assume that people will come. And scientific denialism, I think, is a huge problem. Of course, all of this is now happening under a global pandemic and under a changing climate, and all of these different systems together, cultural, socioeconomic, historical, is Dr. Wood so eloquently discussed. All of these issues come together to create these systems of environmental justice. And with that, I want to thank you so much for your attention. I want to thank my amazing team for all of their great work, and thank my sponsors. And I look forward to our conversation. Thanks.
Outstanding. Thank you so much, Dr. Bell. Well, you sort of jumped right in and took one of the questions that I was actually really interested in. And I love that distinction between scientific literacy and scientific denialism. And I think I had nascent kind of ideas about that one, but I love having the language for that.
And Jude, would it be okay if I jump in and focus on the first part of that question?
I love it.
Yeah, so thank you, Dr. Bell, for addressing that, and thanks for your amazing talk. So someone posted in this question, and I did want to bring attention to the first part of it. So that part of the question was about, are there instances where communities in question, the scientific issues aside, sort of object to being considered a marginalized group or being considered at risk in some way? Like, is that a thing that happens ever?
Well, I'm sure it happens. My personal experience is that in dealing with communities, and of course, like Dr. Wood, I deal with communities that want interaction, is that most communities are hungry for information to help their decision-making process. So they want to know, like an example is we're working with an environmental justice organization in New York City, and they're like, we believe there are these patterns of vulnerability for climate change across New York. And if you look at the data, do you get what we get? The answer is yes. So there's that type of an example. In terms of just a little subtle point on the question is the things of labels, like being labeled a marginalized community and so on. And so the language that is used is constantly evolving, and it is, my job to try to keep up. And also, it's not my decision how communities or individuals or anyone labels themselves. So if a community were to tell me they don't like the label that I'm using, this has happened, don't like the label the way I'm using it in a presentation or something, then I'll change it. Not everyone will agree on how they want things to be framed, but it is critically important that we as scientists not impose labels on people and framing on people. And that's why it's really important to have bi-directional discussion with communities rather than just kind of come in at the end and see like, oh, this is what I found.